The EORTC 1417 reaction trial is a randomized phase 2 trial that assessed the activity of pembrolizumab added to etoposide and platinum salt versus chemotherapy alone in patients with extensive disease, small cell lung cancer. So the characteristic of reaction is that immunotherapy was not added up front. All the patients were previously treated by 2 cycles of etoposide and carboplatin or cisplatinum in order to debulk the disease. Only patients with a partial response or a complete response to this initial 2 cycles were enrolled and randomized, irrespectively of the PD-L1 status on the tumor. Patients receive either 4 additional cycles of chemotherapy or 4 additional cycles of chemotherapy plus pembrolizumab, and then maintenance pembrolizumab up to 35 cycles. Prophylactic cranial irradiation was optional in these patients, and in the control arm, patients could cross over to an immunotherapy, but given as a triplet, meaning that patients that relapsed at least 3 months after the end of the chemotherapy could receive carboplatin etoposide plus pembrolizumab up to 6 cycles, and then pembrolizumab alone. 30% of the patients crossed over. We have enrolled 1,125 patients in the study. The primary endpoint was PFS. It was negative, as that ratio was 0.84. But there was a positive and significant signal on the secondary endpoint of overall survival. The hazard ratio was 0.73. Patients in the control arm had a median survival of 10.4 months, 12.3 months in the experimental arm. Overall, the study has demonstrated that there is a benefit to add immunotherapy even at the 3rd cycle. And I think that one of the take-home message is that we know that sometimes these patients with extended disease small cell have poor performance status, but this is related to the disease, so we treat them with a combo etoposide plus platinum salts. For the patients that would be PS2 and 3 that you would treat with chemotherapy alone because they are unfit for chemo-IO, if the performance status improves during the 2 first cycle and is 0 or 1 at cycle 3, it's not too late to add immunotherapy, and it will bring the same benefit that in the randomized study of immunotherapy upfront.